good. So recording has started. Welcome, everyone. Here we are. It is Tuesday. Every Tuesday and Thursday, we do these 30-minute learning bites. So excited to see you all here at the Healthcare Supply Chain Hub. And let's get jumping in to our amazing topic today, which is bill onlys in the OR. From chaos to control. I don't know how many times people have asked me to do something around bill onlys because many of you utilize this process manually. And I will be honest, the majority of the health systems I've worked at, bill onlys were a manual exception process. So I kind of want to just go through today, help you guys with some tips and tricks to make it not so manual, or at least have standard work around it, and then give you guys some ideas of how to automate it, and then hopefully bring you some massive value for tomorrow. Okay, so that's what we're going to do. I would say when I'm thinking about a bill only and the chaos that it brings in the OR, a lot of times bill onlys really start from a clinician clinical side of things. We don't always have a healthcare supply chain worker that is managing the bill onlys. Usually it's a vendor that comes in, is working directly with whoever the charge nurse is or whoever the supply and equipment coordinator in the OR is. And that is where supply chain not having their hands on the process makes things be chaotic, especially if we haven't set up standard work processes and lean operating system for that standard work. So if we think about unmanaged bill onlys, right, those then equal surprise invoices that come in through accounts payable. And of course, they get funneled to supply chain and we may not know about it. And if we are not managing and don't have our hands on the bill only process from a supply chain standpoint, that's where things get really chaotic. So number one, I want to make sure if you are in healthcare supply chain in the OR, you have to have your hands on managing this process. The other thing is off-contract implants create a financial risk. Now, I'm not telling you to go put every single item that's on a catalog through implants, through an implants vendor into your item master. I'm not telling you to do that, but you've got to be managing your contracted specials somehow through your ERP system, and make sure that you have historical spend on those approved items and those approved implant items that are being utilized in your OR today. Do not just assume that anything and everything can come in through those vendors. Okay. The next piece is documentation gaps lead to audit nightmares. So if you do not have it documented properly what was utilized on the case and on that patient and what is being fed into your EHR system or your EMR system, so Epic or Cerner, right, your electronic health record or medical record to the patient, if the charge nurse is not billing that accurately, those documentation gaps lead to that auditing issue. If something was opened and not used on the patient, but not documented into the patient record, that's a problem. If something was wasted and thrown away and not documented into the patient record, that's a big problem. So we just need to make sure that those documentation gaps are created to standard work. You've got to have standard work around all those processes. And the only way to do that is collaboration 50-50 with your OR teams. And then the last thing on here is site to site inconsistency equals chaos. So if you are a health system and you have multiple hospitals in your IDN, if you don't have a working process and standard work that goes from site to site to site, and you don't have standard work processes that are the same site to site to site within your bill only process. When those bill onlys come in from the individual sites to one standardized place, usually procurement, or even if the invoice comes into AP, you're going to have chaos when it gets there, when you're trying to create the requisition to the purchase order, or when you're trying to match that invoice to some kind of a purchase order. If you have site to site inconsistency in your bill only process, that's where chaos happens. So this is where bill only chaos can happen 4 different ways, but I'm sure there's more than this. But we really need to make sure that you've also got a vendor, I would say, access, credentialing, and control policy in place to make sure that your vendors know what your process is. You're not a good strategic partner with your vendors if they don't know what your standard work process is as well. So I'm thinking, first of all, of some contract guardrails that need to be up here, right? So remembering that vendors must only bring products that are tied to a contract that you've negotiated, you agree on pricing and the terms and conditions, and these are items that you currently utilize today. Remember, we're not opening up an entire vendor's catalog and saying we're going to enter all that into your item master or your item file. We just want to make sure it's things that you currently utilize today, and working with your physicians, with your surgeons, with your supply and equipment coordinators in your OR to make sure, hey, what are our standard items? Okay, those are the items we want to get on contract. Those are the items that we're approved to come in our door. And then making sure that you have locked in pricing for those things. That'll help to give you some contract guardrails. It also prevents cost leakage, right? So if you have something that's coming into your OR and it's not on contract, every single time a vendor bills that on an invoice, they can change the price if you don't have a locked in contract. So whether you have your GPO contract or you have a local contract with that vendor, making sure that you have a pricing agreement and that pricing is uploaded into your ERP system, that is critical. It also protects negotiated savings. So let's just say you did a spine initiative or a trauma initiative or a shoulders initiative, just recently, last 6 months, last 8 months, and you did all this hard work. You collaborated with your surgeons. You guys decided on which items you're going to bring in as standard for your health system. You've done all these things. You ran through the initiative. You executed the new contracts, and you said as a team, we are guaranteed $500,000 worth of savings in the next year because we finished this initiative. Now, if you start to have contractual conflict and things start to sneak into the health system that are not on those negotiated awarded contracts, that's where your savings will start to flounder, and you may not get your full savings that you were supposed to be achieving. Okay, so I just want to make sure that you've got these contract guardrails. They go into your item master, your item file, and your ERP system. Those are your locked in awarded items, and everyone's very clear that this is what is on contract for doing all shoulder surgeries or for doing all, spine cases, ortho spine cases. And then reinforcing the compliance across the OR. This is not hey, Angelique ran a spine initiative. We had great collaboration with our physicians. We had great collaboration with our supply and equipment coordinators in our ORs and our charge nurses, and everyone's on the same page. And then 6 months after the initiative is done, we don't talk about it ever again. Right. So that is why it's important for the supply chain teams that work in the perioperative areas are constantly reinforcing that. Remember, 6 months ago, we awarded X vendor for this product category, or remember, we have a dual source award or a triple source award. I'm starting to see some things sneak back in the OR. Those healthcare supply chain employees in the OR are critical for the success of managing all of these vendors, the contracts in the OR, and then obviously into the bill only process. So I really want to share with you guys a standardized bill only form that I created years and years ago and literally have brought from workplace to workplace to workplace. And I want you guys to be able to use it and make it standard work within your health system. The form itself should capture vendor name, item numbers, descriptions, contract numbers, negotiated price, purchase order linked to it, signatures of the vendor, the charge nurse, everyone's agreeing, some kind of standardized form that's system wide, right? And when I show you guys, I'm going to actually put it in your package today when I send you your recording, the PowerPoint, your massive action checklist for tomorrow. I'm going to send you this bill only form in Word that so that you can take it and go implement it at your health system and make it a system standard. And then I want you guys to create a procedure on your own letterhead, however you guys create procedures within supply chain, and create a 1 or 2 page procedure that goes along with the form so you can train all the folks in the OR on how to use the form. And then when you guys do a contract with a vendor, I want you to be showing them this is our standard bill only form. This is the procedure that goes along with it. You can use the bill only form and the procedure as exhibits in your contract with those vendors to make sure they are following your rules. And I think that that's super important. I have even put the bill only form and the bill only procedure as an appendix in my vendor access and control policy so that when a vendor is acknowledging that in RepTrax or VendorMate or Green Security, where they acknowledge all of your procedures and policies, they're acknowledging that you have a bill only form that's standard and a bill only procedure that is standard. And that just helps everyone in communication, training, making sure everybody sticks to standard work. Okay. So thinking about roles and responsibilities and workflow, right? So the vendor fills out the bill only form. So you got to make sure that your OR has a stack of these blank for vendors to fill out. Now, if you can figure out how to automate that on a computer somehow and you send that to the vendor to fill out, that's awesome. I'm going to be showing you some tools that do that, but maybe you could do something homegrown. That's incredible. The charge nurse then reviews and signs that to make sure those are all the items that were utilized on the case. None of that was wasted. None of that was thrown away. And just really making sure that even the quantities are perfected. And then supply chain validates and processes the form, right? Because you're going to do that through your buyers, through your procurement process in your team. And then there is shared accountability across all the teams doing that. So some kind of workflow where the supply chain logistics technician in the OR is getting those at the end of every day from the charge nurses, and then making sure that those are then flowing to the procurement team. And I've even seen folks where they take that bill only form, they enter a requisition in the OR and attach the bill only form to it. And that's how it gets to procurement and the buyers. So there's many different ways you can do it, but I want you to be thinking about how to better the process within your continuous improvement. So I'm talking about before technology tools for bill only. There's a bunch of them out there, okay? And I want you, if you're going to pay for something like this, because it is, I'm not going to say it's expensive, but it is a yearly cost, okay? There's a bunch of companies out there that do have bill only tools. I just wrote down just a handful. There's so many more than this. But GHX has it, Prodigo, Simpler, Texas, Kermit. Kermit, that's their specialty. Ready Set Surgical, that's their specialty. Seabright Healthcare, that's their specialty. Case Check does a bunch of things, but has that as part of their toolkit. Um, Identity, Owens and Minor. There's many others that have bill only tools out there. If you're going to do an RFP, make sure you include all of the tools out there so that you're kind of making sure that you're comparing apples to apples. What does technology do for you? It automates the data capture and the compliance. So I'm just going to give you an example of Kermit because I'm very familiar with Kermit. Kermit actually goes a bit deeper, and they actually go into your contracts and it reads the contract language. Let's just say you have it capped that a certain surgery only uses a certain amount of screws. Kermit's tool and team actually goes into your contract, reads that. Let's just say there was a cap of 4 screws per case, and if there's a 5 on the bill only, they're going to push back on the vendor for you. So when we talk about compliance, Kermit hits that mark. I'm not here selling Kermit or anything, but I want you to look into all the tools in the same way and what are the benefits of each and every one. They actually, some of them can track the implants from the tray to the invoice. And I know that's one thing that Case Check does well. I've used them in the past and they're fabulous for that. And then it reduces errors and it improves visibility of the items. So there's no hiding. There's no adding an extra thing on. There's transparency, there's trust that's built here when you're using these tools and technologies. Go out and do a bunch of demos and figure out, hey, will this help us? Taking out a manual step out of your process would be amazing. So, yes, I'm giving you a standardized bill only form. You can marry that with any one of these tools. You can make sure that that form is then maybe on an app on one of these tools on your phone or on the vendor's phone. It's the easiest thing to do. And if you guys have some spare money sitting around, I know we all have spare money nowadays. It can actually help to maybe even offset an FTE or some labor. Okay. So kind of looking at what this does, right? The technology, it captures. So the sales rep submits the bill only for items used in the procedure via the cloud. Then it matches, items are matched against approved contract pricing to ensure accuracy. And then it's routed. So the cloud-based workflows automatically route the bill only to the right person for approval. And then the approval happens. So the bill only is approved by hospital staff and then issued, right? So you've got your purchase order is then created and issued to the sales rep so that they can then issue the invoice. So that's kind of how that goes. And so some real little bit deeper dive into that in the capture, the data captures at the point of service, right? So an example of that is the vendor submits the bill only items used in a procedure directly into the cloud based platform using a standardized digital format. That's where I'm talking about the standardized bill only form. You could dictate to the technology company what you want that captured on that form. Not a problem at all. Okay. Then match validation to ensure accuracy. Example, items are submitted on a digital bill. They're automatically matched against the approved items on contract with the vendor. Off contract items then are flagged in the system, and it depends on the technology. But Kermit, for example, they are the ones dealing with and calling the vendor on our behalf. My buyers are not doing that. So if you are out there doing an RFP, trying to find the right solution, you want to ask these questions. What does your solution do and your people do? What does your solution and your people not do? right? And then it routes it, right? It's automated, configurable workflows to streamline the approvals process. Workflows are created to meet the requirements and changing needs of every department, especially if you have a system-wide thresholds and approval process within your ERP for invoicing, for tracking. It will marry and align with what you have today as your policy, and it's cohesive and streamlined experience. Then for approvals, there's streamlined approval workflow. Hospital staff complete their approvals. Then they can assign a PO number to bill using the ERP integration, which is routed back to the cloud platform. If you want, your buyers can do that. I don't always know sometimes that I want clinical staff doing that in the OR. I do like my buyers to touch that and be the ones doing, moving a requisition to PO, or the system, your ERP system can do that once the requisition's entered. And then issue the cloud-based PO number delivery. Example is that the bill and assigned PO number are automatically imported back into the cloud platform and then immediately available to both the hospital staff and the vendors. So it just makes it so much more streamlined. So I just want you guys to look into different samples. So my call to action: standardize your bill only form to get started tomorrow. Okay. Have a procedure with it as well. Train your vendors and your nurses that if there's no form, there's no implant. If there's no form, there's no implant, there's no payment. Right. So we have to have some controls around that. My vendor access and control policy even says if you bring something into our OR that was not approved through value analysis, thank you for the donation. You've got to put some guardrails and policies in place to hold everyone accountable. This is a strategic partnership, not a one-way partnership, right? That's not a partnership. You want to pilot this in high-cost service lines. You start with spine or start across all general surgery, wherever you want to start. You want to explore the tech integrations. If you want to start doing some demos from the companies I gave you names of, okay, go ahead and see what's out there. But you want to audit it regularly for compliance. Every year, I want you to audit, pick 5 or 6 bill onlys that you want to go out and audit to make sure that the workflow flowed correctly to your standard work process. So your massive action starting tomorrow, I'm going to give you guys a massive action checklist. I want you to audit your current state. How are bill onlys handled today? Are they paper? Is there nothing? Is there a mix? Who enters the requisition? All these things. I want you to document what your current state is. And I want you to draft your standard form. I'm going to give you one as a sample. You feel free to use that, make changes to it, add, change, delete to it, but you want to include your contract number, pricing, signatures, and you want to educate your vendors and your nurses and roll out the new normal rules, right? Because you want to have a procedure document that goes along with this. And I want you guys to pilot in one service line, like test orthopedics or cardiovascular for 30 days, right? Test it somewhere. And I want you guys to go out and start exploring tech partners. Do a demo or 2 or 3 or 5 of a bill only module in your current ERP or a bolt-on system. And your current ERPs might have a bill only system. You're going to want to check it out. Remember, your ERP system you have today, whether it's Workday or Infor, Lawson or PeopleSoft Oracle or SAP, whatever your ERP system is today, it probably has some kind of bill only mechanism. You always want to look at your foundational partner first, which is your ERP system, and then go demo some other tech partners. And then I want you guys to set up monitoring, monthly dashboards, number of bill onlys, percentage on contract, savings captured. Those are just some KPIs that you could be capturing within your bill onlys, but I want you guys to set that up, okay? And this is all going to be on your checklist for today's learning bite that you're going to receive. Some hot final thoughts that I want you guys to think about. Bill onlys don't have to be the black hole of the OR. I hear people say the word bill only and they're like, oh my gosh. It's like the word preference card. It's like a swear word in the OR. So, with contract guardrails, a standardized form, the right technology, if you can afford it, you'll move from that chaos to compliance. And at the end of the day, right, all it's about is protecting your organization's finances while giving clinicians the confidence that every product used was vetted, fair, accounted for, at the right price, clinically acceptable, right? All those things, the quadruple aim of your value analysis process. And then I want you guys to standardize it, enforce it, communicate it, track it, because bill onlys done right are bill onlys that are under control. And I want you to be talking about bill only process in your vendor access and control policies as well. So, with that said, I want to make sure that you guys are getting my emails. Make sure you've checked your spam. Mark us safe so that you always are getting your tools for free. I love to send out the recordings, the tools, your massive action checklist. I want to make sure you're always getting those. And then if you guys need to contact me or my staff, let us know at our website or at customer service at healthcaresupplychainhub.com. But I want to continue to make sure you guys know how to get a hold of us. Is this valuable to you guys? What do you guys think today? Who's going to say, is this valuable? What do
Hey,
you think?
Angelique, it's Heidi.
Hey, Heidi.
Absolutely it is. And I, I think what's so great about what you presented is it is a lot of chaos, but it doesn't need to be. And it's integrating the departments working together and setting up every department for success, including the OR. And being a clinician myself from the OR, we don't want our OR staff kind of getting down in the weeds with the billing side of things. That's not our area of expertise. And quite frankly, it's not where we want to be focused anyway. Give us the tools to make it easy for us to kind of check the box and then turn it over to the experts. So I really appreciate the way that you presented all the information and setting up things for streamlining for each of those departments and setting all the groups up for success. I also wanted to comment just on things that can get missed, and that goes back to what's in the contract, because those of us working in the OR, chances are, have never even seen the details of the contract.
Truly, truly. Really good call out, Heidi. I really appreciate that. Because who is negotiating the contract? Supply chain, right? We may have listened to the clinicians on what you want to make sure are on contract, but in the end, we're the ones fully executing it. So, really good point, Heidi. Thank you for your thoughts.
Yeah,
Hey,
as I always say,
yeah,
Angelique, stay in your lane.
stay in your lane. Hey, Kalash, I know you're always on my calls and I love that you're here. Can I ask you a question? Can you unmute yourself? No, can't unmute. Oh, there you are. Hi. Are you,
Yes. Hi,
hey, Kalash,
Angelique.
have you spent any time in the OR or covering in the OR?
Not much.
Not much. Are
At
you
Central
hearing?
Sterile, I did. I'm just covering a Jeff for Central Sterile for a week now, but
Gotcha.
not much of OR.
Are you hearing within your teams, like just around the supply chain team, like headache around bill only? I mean, have you heard that before? Like, oh, bill onlys are a pain. Oh, here we go, bill onlys.
Yeah, I heard that a lot.
Yeah,
With the Nick, yeah, he's saying that it's really hard to track everything down.
yeah, for
So
sure.
it's yeah,
So it's like one of those supply chain swear words out there, probably.
yes, one of
Yes.
that. Yeah,
I love it. I love it. Well,
yeah.
thank you. Thank you, Kalash, for coming off mute. I appreciate you and I appreciate you. You guys this are always supporting me and really appreciate you guys being here.
You are
Okay.
awesome, Angelique. Always something great to learn from you.
Thank you,
Angela.
Kalash. You're amazing. All right, you guys. Good to see you. Happy Tuesday. Go kill it tomorrow. Watch for my email and just keep being awesome in supply chain, okay? I'll see you guys.